When you look back at the last 75 years, India's healthcare system has transformed in ways that are almost hard to believe. It's a story of incredible progress, for sure, but also of these deep, persistent challenges. It really is a tale of two very different eras. Just let this number sink in for a moment. In the 75 years since its independence, the average life expectancy in India has jumped by over 33 years. It went from a shockingly low 37 in the 1950s to over 70 today. I mean, that's just a monumental achievement in public health.
But the big question is, how did this happen? And, does that big, flashy number really tell the whole story? Because, as we're about to see, the journey is a really complex mix of stunning success and, honestly, chronic structural failure. So to really get a grip on where India is today, we have to go back to the beginning, the foundational decades, from 1947 all the way to 2014. This was an era where you had this brilliant blueprint, this amazing plan, but it just slammed into a really flawed reality. And what's so fascinating here is how cleanly this whole story splits into two distinct phases. Phase one, that's from independence up to 2014, was all about laying the groundwork and fighting specific diseases one by one. But phase two, from 2014 on, that's a whole different ballgame. It's a total strategic overhaul, a massive accelerated push for universal health coverage. It all started with this incredible vision. Even before independence, the Boer Committee laid out this amazing blueprint for a modern health system. And the core idea? Wow. It was absolutely revolutionary for its time. A primary care system that mixed both prevention and treatment, and it was supposed to be available to everyone, rich or poor. Okay, but here's the catch. And it's a big one. For nearly 7 decades, that vision pretty much stayed just that, a vision. Researchers have literally called it the pending agenda, this brilliant plan that was never fully built. And the reason? Well, it boils down to one thing: chronic, crippling underfunding. The system was just starved of resources from day one. So you end up with this really strange paradox. On the one hand, the broad primary care system was failing, but on the other, India got incredibly good at these focused, vertical campaigns against specific diseases. The most famous example of this, of course, is the critical role it played in wiping smallpox off the face of the earth.
All right, so fast forward to 2014, and what's the legacy? Well, public spending on health is just stuck at this dismal 1% of GDP. This meant citizens were forced to pay for care out of their own pockets, which pushed millions of people into poverty. And to fill that void, a huge, mostly unregulated private sector popped up, leaving that foundational primary care system weak. Something had to change. And that brings us right into the second era, what we're calling the Great Overhaul. Starting around 2014, the ambition just ramps up dramatically, with one clear, singular goal: universal coverage. So, in 2017, things get serious. A brand new national health policy comes out, and it's basically a complete strategic reset. The goal was to finally fix those historical failures and achieve what the Boer Committee had dreamed of all those decades ago. And the flagship program, the big engine to make all this happen, it's called Ayushman Bharat. It's this massive, groundbreaking intervention with 2 core pillars, and it's designed to create a totally seamless system of care, from your local village clinic all the way up to a specialty hospital. The program's got a really clear, 2-pronged attack. The first pillar tackles the supply of care itself, upgrading over 150,000 local facilities into new health and wellness centers. The second pillar is all about financial protection. It's called PMJA, and it's the world's largest health insurance scheme, covering hospital costs for $500 million of India's poorest citizens. So, okay, the ambition here is massive, no doubt about it. But how is it actually playing out in the real world? This is where we start to see the friction between this bold policy and the messy reality of actually making it happen. And the single biggest threat is the same old story: money. The 2017 policy promised to get public health spending up to 2.5% of GDP. But look where we are. It's only nudged up to around 1.6%. This chronic funding gap puts the entire project in jeopardy. And that big insurance scheme, PMJA, well, it's hit some really serious roadblocks. We're talking widespread fraud, over 1,000 corruption cases reported. More than 1,100 hospitals have actually been kicked out of the program for fraudulent claims. On top of that, Beneficiaries are reporting poor quality of care, and get this, very few private hospitals, only about 3%, are even eligible to participate. That creates huge gaps in access.
And while all of that is going on, there's this other, equally ambitious push happening in parallel to digitize the entire system. It's called the Ayushman Bharat Digital Mission, or ABDM, and the goal is to create a national ecosystem where every single citizen has a unique health account and can access their medical records from anywhere.
But you guessed it, ambition is slamming into a tough reality all over again. Adoption has been really slow. You hear from users like the one quoted right here who just don't see the point. They say the app simply doesn't provide them anything. It points to a massive trust deficit and, frankly, serious concerns about data privacy. So all of this brings us right to the present day and to what you could call India's unfinished agenda. With a plan this big, the stakes for over 1 billion people really couldn't be higher. This table really sums up the entire story perfectly. You can just see the difference, right? Across every single dimension, from primary care and financing to digital strategy, you can see the massive shift from a passive, under-resourced approach to an active, incredibly ambitious one. It's not just a change in policy, it's a complete paradigm shift. So what's the final verdict here? Well, the vision for universal health coverage, that old dream of the Bohr Committee, is finally in place. But, and this is a big but, its success is so far from guaranteed. The whole structure is precarious, threatened by that persistent lack of funding and these huge challenges in making it all work on the ground. Which leaves us with the ultimate question. It all boils down to this, doesn't it? The blueprint is drawn, the ambition is crystal clear. But can India muster the sustained investment and the good governance needed to finally make quality healthcare a reality for every single one of its citizens? That remains the unfinished agenda.